Welcome, friends, to Broken Narratives. I am your host, Jay Firangi, coming to you from the Still City, Hamilton, Ontario. Thanks for joining me on this 10th episode of my COVID 19 series. In the last episode, I had covered COVID 19 vaccine effectiveness, and as you learned that many of the claims made regarding COVID 19 vaccine effectiveness were either false or misleading, and how COVID-19 vaccine were never tested to stop the transmission of the disease, but news media and government health officials kept saying that you won't catch the disease or spread the disease. And you also learned that natural immunity, which was providing long-lasting protection against different variants, but it was ignored. And despite having natural immunity, everyone was either forced or coerced to get vaccinated. So in today's episode, I will cover few topics like vaccine hesitancy, vaccine incentives, protest against vaccine mandates, and finally negative impact of vaccine mandates on healthcare system. So the first clip is a compilation where you will hear different news media outlets and different pundits on news media outlets saying that unvaccinated people are the problem, and how they should be treated, and they should be kept out of hospitals, and people who are vaccinated should be given priority. And this kind of discriminatory language was used throughout the pandemic.
Unvaccinated people.
My message to unvaccinated Americans is this.
If you are the unvaccinated, you are the problem.
You're the problem.
Condemn them, shame them, blame them.
The only people that you can blame are the unvaccinated.
Frankly, we can't trust the unvaccinated.
They should not be part of polite society.
Lunatics who won't take COVID vaccines walking around lawfully unvaccinated? That's psychotic.
If you're willing to walk among us unvaccinated, you are an enemy.
You have no right not to be vaccinated.
You don't have the right to contaminate someone else.
You can't go around pointing a gun in somebody's face, which is what it is when people are unvaccinated.
They are all idiots and losers.
This is a real movement in this country against the unvaccinated.
Jennifer Aniston is cutting non-vaccinated people out of her life.
The unrepentant unvaccinated.
They should be removed from the hospital.
Those who refuse to be vaccinated should be denied health care.
Vaccinated person having a heart attack? Yes, come right on in. We'll take care of you. Unvaccinated guy, rest in peace, Wheezy.
And many of these statements were made after we knew that vaccine was not going to stop the transmission or stop you from catching the disease. And people were still saying that people should not be given treatment if they are not vaccinated, and other people should be given priority. So the second clip is from April 2021, and this is from CNN, and you will hear Dr. Lena Wen. She's an American physician, author, professor, speaker, consultant, and during the pandemic she served as the public health communicator, and she was frequently on CNN and also on other news media outlets in US. And in this clip where she was with Andrew Cuomo, host of the show, she was saying that vaccines should be used as a carrot on the stick to get people back to normal life, and people like from January 2021, few states had lifted all the restrictions like Florida, Texas, and a dozen more states. So she was worried that people won't get vaccinated. And the statement she made in this clip was shocking, but people don't see it that way. Let's hear what she was saying at that time.
clear to them that the vaccine is the ticket back to pre-pandemic life. And the window to do that is really narrowing. I mean, you were mentioning, Chris, about how all these states are reopening. They're reopening at 100%. And we have a very narrow window to tie reopening policy to vaccination status. Because otherwise, if everything is reopened, then what's the carrot going to be? How are we going to incentivize people to actually get the vaccine? So that's why I think the CDC and the Biden administration needs to come out a lot bolder and say, if you're vaccinated, you can do all these things. Here are all these freedoms that you have. Because otherwise, people are going to go out and enjoy these freedoms anyway.
So yes, he did not want people to enjoy their freedoms without getting vaccinated. Now let's see some incentives that were used by governments around the world. And the first example I have is from May 2021. And you will see New York City Mayor Bill de Blasio eating a burger and showing that one of the incentive was that you can get a burger and fries. This was one of the most disgusting incentives that was used, and display of disgusting behavior by a major politician in US.
Free fries when you get vaccinated? I got vaccinated. You're saying I could get this? These delicious fries? Wait a minute. But there's also a burger element to this? Let me check with Bill Neathart. Is it too early in the day to eat a burger? No. This could be breakfast? Okay. I want you to look at this and think about, again, some people love hamburgers, some don't. Really want to respect all ways of life. But if this is appealing to you, just think of this when you think of vaccination. Vaccination. I'm getting a very good feeling about vaccination right this moment.
Yeah, like children, like they were offering these kind of incentives so that you take the vaccine. Now, all governments were not the same way and they had used different tactics. And this next short clip is from Australia, and how federal government of Australia was trying to use graphic ads to encourage people to get vaccinated.
Authorised by the Australian Government, Canberra.
Okay, so that was not very healthy way to encourage people to get vaccinated. That's what I think. And now I want to go through some articles. First, a couple of articles regarding vaccine hesitancy, and then regarding vaccine incentives from different states in US. And this first article is from Forbes, and the title is "Large Number of Healthcare and Frontline Workers Are Refusing COVID-19 Vaccine." And this was published in June 2021. Let me give you some details that how many people were refusing to get vaccinated. Earlier this week, Ohio Governor Mike DeWine said he was troubled by the relatively low number of nursing home workers who have elected to take the vaccine, with DeWine stating that approximately 60% of nursing home staff declined the shot. Dr. Joseph Vernon, Chief of Critical Care at Houston's United Memorial Medical Center, told NPR in December more than half of the nurses in his unit informed him they would not get the vaccine. Roughly 55% of surveyed New York Fire Department firefighters said they would not get the coronavirus vaccine, the Firefighters Association president said last month. The Los Angeles Times reported Thursday that hospital and public officials in Riverside, California have been forced to figure out how best to allocate unused doses after an estimated 50% of frontline workers in the county refused the vaccine. Fewer than half of the hospital workers at St. Elizabeth Community Hospital in Temaha County, California, were willing to be vaccinated, and around 20 to 40% of LA County's frontline workers have reportedly declined an opportunity to take the vaccine. Dr. Nikhila Juvadi, I hope I pronounced that name correct, the chief clinical officer at Chicago's Loretto Hospital, said that a survey was administered in December and 40% of hospital staff said they would not get vaccinated. So you can see that sometimes like close to 40 to 60% of frontline workers were refusing to get vaccinated when they were asked in June 2021. And here is another article from Unheard. The most vaccine hesitant group of all, PhDs. Researchers from Carnegie Mellon University and the University of Pittsburgh, they had conducted a survey and analyzed more than 5 million survey responses by a range of different demographic details and classed those people who would probably or definitely not choose to get vaccinated as vaccine hesitant. It finds that the association between hesitancy and education level followed U-shaped curve, with the highest hesitancy among those least and most educated. People with a master's degree had the least hesitancy, and the highest hesitancy was among those holding a PhD. So PhDs were the most hesitant people among everyone. They were against getting vaccinated. So these are big numbers, and not everyone who got vaccinated because they believed that vaccine would help them and help them fight COVID-19, but they had issues when it comes to claims regarding vaccines effectiveness. Here there is one line in this article I should read from the Forbes article. A recent survey by the Kaiser Family Foundation found that 29% of healthcare workers were hesitant to receive the vaccine, citing concerns related to potential side effects and lack of faith in the government to ensure the vaccines were safe. So these were the underlying reasons that many of frontline workers were not going to get vaccinated. And now let's see some incentives. And this first one is from CNET. New York announces 5 million lottery entry for those who get vaccinated. I'm just going to read headlines here because there are many. The White House is hoping new vaccine partnership with dating apps will convince singles to get their shots. ABC News. These Florida concert tickets are $18 if you are vaccinated and $1,000 if you are not. The promoter behind the discount hopes it encourages people to get their shot. KSL.com. Krispy Kreme offering free daily donuts for the rest of 2021 to those who receive COVID-19 vaccine. Doesn't seem to be a healthy idea. And some negative as well. This one is from Delaware, Ohio News.com. Biden orders VA to withhold health benefits from unvaccinated veterans. So this is straight up like bad thing to do to people who had served the country and withhold their benefits if they don't get vaccinated. And did any of these incentives, positive or negative, work? And here I have a clip from October 2021 from a North Carolina news outlet, and they will discuss how a $1 million vaccine lottery incentive did not work, and same thing was found all around the country in US.
Even with
about the chance at winning $1 million? It didn't do much to convince people to get vaccinated against COVID.
That's what a team of researchers are now saying about North Carolina's vaccine lottery and every other state that attempted the same thing. Tonight, we're digging deeper into what they found and why it didn't work. Researchers who published their findings in the Journal of the American Medical Association found the effect of the vaccine lottery to be near zero in every state that had one, including North Carolina.
When we looked at the timing of announcements for these vaccine lotteries, we tested for whether or not there was a change or an uptick in vaccination rates, and we found that vaccination rates remained essentially stable.
Economist Benjamin Hansen was part of the research team.
Our point estimate would be 0%. That there was effectively no change at all.
Despite his team's findings, Hansen applauds states for trying, but hopes this is a lesson.
But when you find something doesn't work, then you want to turn to something else that might work better.
So in US, they had done the research and found that those vaccine incentives of $1 million lottery and similar incentives by other states did not work. So government spent so much money on incentivizing people, but it didn't work, which was good and bad. It was good because especially in US, people were aware and they did not give up, and they held their line and did not get vaccinated due to these incentives. And bad because governments wasted millions of dollars with these incentives. And next clip we will show you how even people who were vaccinated did not have freedoms and rights that were that they were saying that you will be able to do this and that, but they also had to go through similar routine checkups at the airport. And this clip is from CTV News in Canada, and you will hear a mother with who had to take multiple tests despite being double vaccinated. So when it comes to travel, there were no advantages in some countries. And let's hear details of this mother who was double vaccinated and still had to get multiple COVID-19 tests to enter back into Canada.
As more Omicron cases are confirmed in Canada, officials are utilizing the precautionary principle. Better to keep people in quarantine now as information about the new variant comes in. But what's really going on inside these quarantine hotels? Travelers returning from banned countries are claiming they're being neglected. Some are saying, we're underfed, we're being mistreated. Tiffany Gora is a Canadian who's under mandatory travel quarantine after returning from Cairo, Egypt, with her 5-year-old and her 8-year-old and her husband. What was it like for you and your family inside this quarantine hotel? Can you describe what you went through?
Thanks, Evan. Yeah, absolutely. I mean, it was an extremely difficult and, onerous and traumatic process for myself and our 2 daughters. You don't have fresh air, you can't exercise, you can't leave. The food is atrocious and it's not nutritious, and there's just it's absolutely mind-boggling that you could hold healthy, law-abiding, fully vaccinated citizens in these kinds of conditions. We had 2 negative PCR tests before getting on the plane to come to Canada, and then we waited 3 days to have a third Canadian PCR, which resulted also negative.
So you get your PCR test in Egypt, and then you get another one where you stop over in Frankfurt. You pay for all these tests yourself. How much were they?
PCR tests in Egypt are about $100 a person, so that's $300. And we needed quick turnaround in Frankfurt, so we had 1.5-hour tests, which are about 179 euros a piece. So it's an extremely large expense for a family, for sure.
So as you heard that she was double jabbed, and they had negative PCR test as well, but still after coming to Canada they had to stay at a hotel at their own expense and get one more negative test. So what was the benefit of having COVID-19 vaccine? And this is just one example, but there were many more. I have had seen many more examples like this throughout the pandemic. There was one or two that were more disturbing than this. That there was an elderly gentleman in Canada when again this was at the airport, and the guy had the proof of vaccination, but it was a paper, and it wasn't a QR code. And the person who was at the immigration office at the airport wouldn't allow that paper to be accepted as a proof of vaccination. They were like, you must show a QR code, and the paper wouldn't work. There were a few more examples, and people who were mistreated. There were many people who were forced to quarantine in hotels even after being vaccinated, and they were saying that, like, what did we do wrong? We followed all the government guidelines and rules, and we were still being treated like this and second class citizens. So this were a big issue during the pandemic, but you may have not seen on corporate news channels. And here is another clip, a compilation of how news media was saying that restrictions should be placed on unvaccinated people, and you should not invite your unvaccinated family members to family events and things like that.
It is not your right as an American citizen to catch and transmit a potentially fatal infection.
So screw your freedom. We can coerce you.
You're not going to be able to travel to see your family. If someone in your family isn't vaccinated, should you ask them not to show up?
Yes, you really shouldn't have anyone unvaccinated come to dinner. That's just a huge risk.
If you want to come out into public, if you want to live your life, you need to get the vaccination.
It's time for people to see vaccination as literally necessary.
You should have to show that you're vaccinated in order to go places.
Unvaccinated tennis player can't travel to the U.S.
How come migrants are allowed to come into this country unvaccinated, but world-class tennis players are not?
Yeah, another discrepancy in rules enforcement, where many undocumented immigrants who are coming to US, Canada were allowed without being vaccinated, but most of the people who are flying to US, Canada legally were forced to get vaccine, or they had mandate they wouldn't come into these countries without showing the proof of being vaccinated. And now let's see some examples of politicians flip-flopping on vaccine mandates. And like they were before, they were saying that vaccine mandates are immoral or they are illegal, and after months or so they flipped and they imposed vaccine mandates. And first one I have is of Prime Minister Justin Trudeau.
Misinformation and disinformation is carrying people to believe things that are untrue. And vaccinations is a perfect example of it. Any vaccine we distribute to Canadians will be safe for Canadians. You know, our people who've probably gotten very sick from vaccinations. Every vaccine that is approved is safe for Canadians, is uncompromising. Well, individuals are allowed to make their own choices. There may be all sorts of different reasons why someone is hesitant to get vaccinated. There's no more excuses to not get your shot. And therefore, while not forcing anyone to get vaccinated, enforcement measures in place will make sure that everyone is vaccinated. I chose to make sure that all the incentives, travelers across the country need to be fully vaccinated. People coming into the country need to be fully vaccinated. We're there, don't get to work in the public service, don't get to go to movie theaters or gyms or restaurants.
So people lost their jobs in Canada, and that was also true for most of the countries. But after those imposing those mandates, Justin Trudeau was saying that people could be hesitant and cannot get vaccinated for many reasons. But he was yelling at the rallies during an election time, and that people who do not get vaccinated don't have a right to sit on the plane next to you, and he was demonizing people who did not get vaccinated. And here is one more example of that, of Doug Ford, Ontario Premier. Here is a conservative leader doing the same thing.
Will your government provide an actual card or proof of vaccination? And if not, why not?
Well, I've never believed in proof. Everyone gets their proof when they get the vaccination. You're right. Anything can be fraudulent, right down from money to certifications. I just, no, we aren't doing it. Simple as that. We're just going to move forward. Now, if it's federal, getting across the border, that's up to the federal government. We'll see what they decide to do. I'll be talking to the Prime Minister tonight. But the answer is no. We aren't going to do it. We aren't going to have a split society. All the provinces, all the premiers have requested a national vaccine passport. It's a lot easier, standardize the system, and then we can utilize that right across the board, no matter if we're traveling abroad or going into a restaurant. It's just so much easier. No, I think it's their constitutional right to take it or not take it. These are super bright people that work their backs off, but no one should be forced to do anything. You know, I'm double vaxxed. Everyone around here is double vaxxed. So for one reason or another, for health reasons or otherwise, that's going to be up to the people.
So yes, before he was saying that it's a constitutional right to get vaccinated or not. We are not going to have split society, and there are many reasons that people may not get vaccinated. But he changed his mind, and he also imposed vaccine mandates to go to certain venues and travel across the provinces, citing that other provinces are doing that, other countries are doing that, so it makes things easier. And New Zealand Prime Minister at that time, Jacinda Ardern, she was very straightforward when asked regarding creating a two types of citizens and who have different rights. She was very forthcoming and answering that question.
So you basically said this is going to be like, well, it's almost like, you probably don't see it like this, the two different classes of people. If you're vaccinated or if you're unvaccinated, you have all these rights. If you are vaccinated,
that is what it is. So yep.
Yes, that is what it is. That's what she said. Like, if you are vaccinated, you have certain rights, and if you are not, you don't. So yeah, people who were not vaccinated were treated like second-class citizens in many countries. And I have few more articles that I want to go through, showing different kind of policies around the world for different people as well. And this one is from the Business Insider. States spent at least 89 million on COVID-19 vaccine lotteries. None of them worked, new research suggests, as I discussed before. Here is from Newsweek. Members of Congress and their staff are exempt from Biden's vaccine mandate, published on September 10th, 2021. So not everyone was forced to get the vaccine. Here you can see that Biden's order on federal workers applies to employees of the executive branch. The House of Representatives and the Senate belongs to the separate legislative branch, and the courts to the judicial branch of the federal government. And they did not have vaccine mandates. Here there is a statement from Nancy Pelosi. Speaker of the House Nancy Pelosi said at a press conference on April 29 that the House couldn't require members to be vaccinated. Video clips of those remarks gained renewed attention online following Biden's announcement. So here is the thing. We cannot require someone to be vaccinated. That's just not what we can do. It's a matter of privacy to know who is or who isn't, Pelosi said. I can't go to the Capitol physician and say, give me the names of people who aren't vaccinated, so I can go encourage them or make it known to others to encourage them to be vaccinated. So we can't do that, she said. So here is a prominent politician who said that not everyone was forced to get vaccine. They couldn't do that to certain group of people. Here is a negative impact of vaccine mandates, and this one is from The Guardian. Care homes in England set to lose 50,000 staff as COVID vaccine becomes mandatory. Analysis shows care of about 30,000 residents could be affected. Here is CBS News. Austria orders lockdown for residents who have not received COVID-19 vaccine. The move prohibits unvaccinated people 12 and older from leaving their homes except for basic activities such as working, grocery shopping, going for a walk, or getting vaccinated. The lockdown affects about 2 million people in the Alpine country of 8.9 million. So people who did not get vaccinated were put on lockdowns. And here is one more. These are just examples. I can do a separate show on all of these topics and it will go forever and ever. This one is New York hospital to pause baby deliveries after staffers quit over vaccine mandate. So there were, I think they said that not even that many. 20 of the staff members who resigned worked in clinical positions like nurses, therapists, and technicians, the newspaper reported. So they had to do things like that, and that hospital care and healthcare was impacted by this kind of vaccine mandates. And one of the best and clear example of this I have is from this clip from CNBC News. This was in September 2021, and how hospitals were asking people who had COVID-19, who had tested positive for COVID-19, to come back to work. And this was shocking. This was in January 2022, after people who were not vaccinated were fired and lost their jobs. Let's hear those details.
Across the country, hospitals battling staffing shortages now taking an astonishing step, asking healthcare workers with COVID to return to work. The move comes as the nation's hospitals are facing a double whammy: daily case counts and the hospitalization rate hitting record highs, while hospital workers out with COVID are creating severe staffing shortages. The combination prompting the CDC to update return to work guidelines for healthcare workers. Experts, however, say the change isn't unheard of outside of the U.S.
This is about cohorting, right? This is about having people who are already infected, taking care of infected people.
California isn't alone. Hospitals in Hawaii, Arizona, Maine, and Rhode Island also changing their policies. An unprecedented move for an unprecedented moment.
So true. Priscilla Thompson joins us now here in studio. And Priscilla, I think there's only one question tonight on this, and a lot of people at home are going to be asking this. Will these infected doctors and nurses that are allowed to work while sick with COVID, will they be able to treat patients? We know they will be treating patients, but could they possibly get those patients sick?
Well, doctors tell me that if those healthcare workers have on that N95 mask, they have on an additional mask and a face shield, those patients should be protected. However, there is debate around whether a patient should be informed if that healthcare worker that is working with them is positive for COVID. If a family member has a loved one in a nursing home, should they be allowed to know if the people working with them have COVID?
So people who had natural immunity by acquiring the disease, COVID-19, they were not given exemption, but people who got vaccinated, but as you can see, contradiction there as well, that people who who were vaccinated but still testing positive or had contracted the disease were called back to work, and patients or loved ones of patients were not being informed that people that who are treating them have COVID-19. And you also heard about masking, that how would they make sure that people who have COVID-19 and treating those patients would not infect them. And the lady said that if they wear N95 mask and shield, that would prevent them from spreading the disease. So if that is true, then why wouldn't they allow people who did not get vaccinated also wear those PPE and treat patients? But that also doesn't make any sense. And as I had discussed during the second episode, that N95 mask and shields, all those things don't work anyway. And here is another clip of how media was pushing to divide families. And this one is from Australia, and this clip is from November 2021. And they discuss how people should get together during the Christmas time, and how should they how they should consider not inviting unvaccinated family member, or what other precautions or way they can avoid being confrontational with their unvaccinated family members.
Now, as Christmas approaches, many of us will be faced with a new dilemma: how to handle unvaccinated loved ones, and whether you should spend time with them over the festive season, sit next to them at Christmas dinner.
So how do you find out who is vaccinated, and how do you decide whether to invite them over for Christmas lunch? We've got the tips and the tricks to help you avoid awkward encounters.
This year, we're all facing a very unique predicament.
These conversations about whether somebody is vaccinated or not can be challenging because it is a personal question. But if you have public health rules in your state or territory that mean that you can't gather with the unvaccinated yet, then you need to ask that question.
Professor Julie Leask says it's imperative to think about the other people who will be attending your social event too.
Whether they've got, say, a chronic disease or severe immunocompromise that might put them at extra risk if they do happen to get COVID even though they're vaccinated.
Etiquette expert Anna Musson says there's no polite way to ask for someone's vaccine status, but there are things we can do to make it easier.
It's your house, so you can decide as a family, everybody's welcome, come one, come all, the doors are open. Or you can decide to say, we love you. However, this year we're deciding to err on the side of caution, and only vaccinated people are coming for Christmas.
Anna's top tips are: be upfront. Having the conversation early and directly is paramount. You can blame the health advice for not having unvaccinated guests over, or move the celebrations to a venue. Then you're guided by their rules. Alternatively, consider having the celebration outdoors where the risk is less. But even the vaccine experts agree that being around the ones you love is the most important part of the festive season.
But still they were saying things like it's a private decision, it's your home, if you want to or not, then why are you producing this kind of report and encouraging, kind of nudging people to not invite their family members to Christmas dinner and other social events. So now towards the end of this episode, I have two clips of vaccine protest against vaccine mandates. And there were protests throughout the pandemic against lockdowns, mask mandates, vaccine mandates, and one of few of the largest protests that I had seen during the pandemic were in UK and Europe. Canada also had one of the biggest protests, very well known, the trucker convoy. But I'm not going to cover that. Otherwise, it would take one full episode. Not even it would take me 2-3 hours. I can go on and on what went on during the trucker convoy. But just let's see a couple of examples of protest against vaccine mandate. And this first one is from Rebel News in Canada, and This is from Calgary, where frontline workers, again people who were treating patients and working throughout the pandemic, and who were cheered on as they were serving their country and their fellow citizens, and taking those risks to continue to work and serve people. But now, when vaccine mandates were imposed, they were not given exemption. People who were treating patients throughout the pandemic during 2020 and 2021, why would they need vaccine mandates if they were able to treat patients and either avoid the disease or catch the disease and get natural immunity? Were not given exemption when it comes to vaccine mandates. And let's see that report from Rebel News.
So here for Rebel News, and we are at Olympic Plaza, where a large crowd has gathered to protest against vaccine mandates. This isn't an anti-vaccine protest. This is a freedom of choice protest, a protest in support of bodily autonomy. Numerous people are here, including firefighters, nurses, frontline workers, and a number of other workers who are gathered in solidarity to oppose this violation of our fundamental freedoms.
I work for AHS, and they're mandating...
For 30 years, for over 30 years, and they're going to fire her when she has had COVID and has natural antibodies and has helped people throughout the entire pandemic.
Lots of people have often said this is a fringe movement with the size of the crowd here, the ever-growing numbers. What does it feel like to be part of this community that's out today?
It makes me feel like I have more faith in humanity, and I hope that people will wake up and realize what the governments and companies are trying to mandate, that this is wrong. We have freedom, and we're in a free country, and this cannot go on.
So that woman served patients for 30 years, and she was fired. She lost her job. She also was serving, as you heard, during the pandemic as well, but she wasn't given vaccine exemption even after having natural immunity. And this last clip is from Australia and from Adelaide, and I think it's Channel 10. They're reporting on protest against vaccine mandates by frontline workers, nurses, and firefighters.
Hundreds of people hitting the streets to protest the no jab, no job policy.
We are the voice for our people in South Australia. We are the voice for patients. What about the people with cancer? What about the people with cardiac illness? What about the kids with leukemia? No one cares anymore. No one cares about anything but COVID.
Our weird and evil government are trying to bully these people here to take the jab.
Kathy Byrne is a mental health nurse. She's been in the job for 32 years.
I've got 2 degrees. I'm not an idiot. I'm not standing here because I'm an idiot. It's because we care about the South Australian community.
She's one of around 500 staff at the Flinders Medical Centre who are refusing to be vaccinated, saying she's one of 2,500 statewide.
And I'm lucky I've got a husband. A lot of my friends haven't, okay? They're on the verge of getting kicked out of their houses.
Many oppose vaccinating 5 to 11-year-olds.
As we know that this virus is not hurting kids, so basically I feel like we're using the kids as a shield to protect older people, and that just seems like quite a twisted way to run society.
So there you have it. So many people who had experience for decades and decades working in healthcare system were fired based on these vaccine mandates. They wanted to serve their community and take care of patients. As you heard, that nurse also said that what about these other conditions like cancer and leukemia, but those people were ignored. I have covered those details in lockdown episodes, that all the collateral damage, all this focus only on COVID-19 and not enough focus given to heart conditions or cancers, which are two top reasons people die and a leading cause of deaths, but they were ignored, and how cancer scanning and treatments were delayed or cancelled throughout the pandemic. But this kind of concerns of nurses, healthcare workers were ignored, and they were fired wrongfully due to COVID-19 mandates. So this brings me to end of this episode. You learned about vaccine hesitancy, how like close to 40 to 60% of even frontline workers were against COVID-19 vaccine, and they were not going to take them, and how incentives did not work, especially in US, and they had done the study, and even millions of dollars of lottery incentives did not work, and there were many negative impact of mandates. People did not get proper care. They had to call back vaccinated people who were infected with the virus back to work, and things like this were going on all around the world at smaller or larger percentage. So next episode I will cover how COVID-19 deaths were counted before I cover the most important and most controversial topic of vaccine safety. I have covered vaccine effectiveness but not vaccine safety. So in the next episode I will cover how COVID-19 deaths were counted, and then I will cover COVID-19 vaccine safety data. So with that, I would like to thank you everyone for joining me and watching Broken Narratives. I am your host Jay Firangi, coming to you from the Still City, Hamilton, Ontario, and I will see you in the next episode.